Oh, good afternoon, everyone. My name is Yilun Sun. I'm a staff member from the Department of Biostatistics at Sanju Children's Research Hospital. Today, I'm going to present you a SAS macro we have developed to project the hospital bed census from the daily new cases of COVID-19. This is a joint work with our faculty members, Dr. Murray and Dr. Tang. Here is the outline for my today's presentation. I will start with our motivation and our approach, and then I will talk about details of the SAS macro and give an example of using the SAS macro. Finally, I will discuss our conclusions and the future work. It is important to plan for hospital resources during the COVID-19 pandemic so that local health partners can take action to ensure the availability of the sufficient bed capacity to accommodate patients with critical illness. To achieve this goal, one question being commonly asked is, can we project the hospital bed census in the near future? One way we can do is use the past hospitalization data to project the future trend. However, we may have some problem with it, and here is an example. This graph shows the hospitalization data in Shelby County, Tennessee, over a period of time. Suppose the task here is to project the future trend at the red star. If we use the past hospitalization data, we will probably think the future trend is going up, like the purple dashed line. However, the actual trend is going down. Observations like this makes us wonder whether there is another variables in the driving seat for those trend changes. And we think the driver is the daily new cases. So our objective is to project the hospital bed census in the near future based on the newly confirmed cases that has been observed, assuming there is a lag between the positive diagnosis and hospitalization. And our approach is microsimulation. It is a computer-dependent technique for simulating a set of data according to some rules. It operates at the level of individual units. And we want to use this method because it can provide insight into the impacts of changes in conditions on a given population. This slide shows our microsimulation idea. There are three elements: input, software program, and output. For the input part, we are going to need data of the daily new cases of COVID-19 and some knowledge about some key parameters. And based on those inputs, we can simulate a group of positive cases for each day during the monitor period. And we expect some of those positive cases will be hospitalized after several days, and they will stay at the hospital for different lengths of time. And we will collect those individual hospitalization data. And based on those individual hospitalization data, we can then calculate the number of hospital bed census for each day during that monitoring period. And this is for just one round of simulation. By repeating this process, we can get results for many rounds of simulations. To implement our microsimulation idea, we can use this SAS macro. It will use a fixed probability of hospitalization and a random length of a hospital stay. Here we assume that the length of a hospital stay follows an Erlang distribution, which is a shape parameter of alpha and a scale parameter of beta. And our SAS macro also allowed users to specify the number of simulations, the monitor period in days, and the days from infection to hospitalization. And here are the inputs and outputs of the SAS macro. For the input part, most of the parameters have been already mentioned in the previous slide. Here, I want to focus on two things. First, this version of SAS macro cannot take time series input of daily new cases. So instead, we will use average daily new cases as input data for the SAS macro. Second, we include a scale factor for the daily new cases. This is under the consideration that the hospital catchment area could be different from the case reporting area. For example, if the local hospitals admits many cases from outside the local area, this scale factor will be greater than 1. On the other hand, if many local cases cannot be treated by the local hospitals, this scale factor will be less than 1. And for the output, we will get 2 datasets after we successfully running the SAS macro. One contains the individual hospitalization data, and the other contains the simulated hospital bed census. Now let's look at an example of using the SAS macro. We use the data from the Shelby County Health Department, and the overall study period is about 3 months. And the study period was further divided into 3 time intervals. Average daily new cases for each time interval was then used as input data for the simulation. And I will talk about it in detail in the next slide. This graph shows the daily new cases of COVID-19 in Shelby County during the study period. From this graph, we can see the raw data were noisy. However, the curve for the weekly average was relatively smooth. So the cutoffs for different time intervals were then selected based on those weekly average of the daily new cases. In period 1, the weekly average remained below 100. In the period 2, the weekly average remained between 100 and 200. And in the period 3, the weekly average remained above 200. And we assume that the daily new cases were close to the average number in each time interval. And those numbers highlighted in blue will be used as the input data in the SAS macro. We just talked about the input data. Here is the information for the input parameters. Days from infection to hospitalization was determined to be 7 days. And for the length of hospital stay, we used an Erlang distribution with shape parameter of 2 and scale parameter of 6. Here we do not distinguish between the survivors and the non-survivors. To estimate the probability of hospitalization, we use data from the Tennessee Department of Health. The probability was estimated as the number of patients newly hospitalized divided by the number of newly confirmed cases from 7 days ago. And the estimated value for period 1, 2, 3 is 11%, 9%, and 7% respectively. Here are the values for other inputs parameters. Particularly, we assume that the average daily cases in the Memphis metro area is the 1.22 times the average daily cases in Shelby County. This scale factor 1.22 was calculated as the population in the Memphis metro area divided by the population in the Shelby County. And here are the input values for the SAS macro for each period. And for the daily new cases and the probability of hospitalization, we use different values for different periods. And for other parameters, we use the same values for different periods. And for each period, we will run 1,000 simulations. Here is the summary of the SAS output for each time period. In each graph, the gray curves are the 1,000 simulations. The red curve is the calculated mean based on the simulations. The red dashed curve indicates the mean plus or minus the 2 standard deviations. And a plateau was observed in all 3 graphs. It can be interpreted as the full impact of the daily new cases on the hospital bed census. And we can see it takes time to reach the plateau, partly because we assume that there is a lag between the positive diagnosis and the hospitalization. And the mean associated with the plateau will be our projected number of the hospital bed census based on the daily new cases. And we can also create a projected interval based on the mean and the standard deviation. To evaluate our model, we plotted our model estimate and the actual data. And let's take a look at the orange curve. It indicates the COVID-19 daily new cases. At the beginning of our study period, the daily new cases were relatively low, and the average is about 80. Based on that information, we have our first projection interval highlighted in green. If our model is working, we expect to see the actual value will be within the green interval. And we do see the black curve, which indicates the actual data stays in the green interval. And then there was an increase in the daily new cases. Now, then we have our second projection interval highlighted in yellow. And if our model is working, the black curve should stay in the yellow interval, which is confirmed. Later, the daily cases surged to more than 300, and the average daily cases is about 321. And if our model is working, we expect to see the black curve stays in the purple interval after several days. And our expectation is again confirmed. To sum up, our SAS macro can be used to project short-term COVID-19 hospital bed census based on the past daily new cases. And the user can use different parameters based on their own experience and their assumptions. And this SAS macro can also be used to conduct sensitivity analysis. Our future work includes extending the SAS macro to take time series input of the daily new cases, relaxing the fixed parameters requirement for key parameters, and we will develop a ShinyR app. Personally, I want to thank Dr. Murray and Dr. Tang for their support and help. And as a group, we are grateful for the support from Sanju Children's Research Hospital and LSAC. We would also like to thank David Swab from the Shelby County Health Department and all the other members in the ESF8 data modeling subcommittee. Here are the links for our data and our SAS macro. Here are the references. Thank you for your attention.